the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday, I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. This is an episode that will hit home for so many people who've suffered a loss during the pandemic.
I feel like it ruined my life in a sense.
The COVID pandemic forever changed Michelle DiMartino's world, and she's still dealing with those changes and the losses today. We'll explain the potentially deadly cardiovascular complications that COVID also brought to Michelle's life. And speaking of the heart and COVID, there's new research indicating a link to COVID infections and an increased risk of cardiovascular disease and stroke. This study was funded by the National Institutes of Health. It shows COVID directly infects the arteries of your heart. That causes the fatty plaque inside your arteries to become inflamed. That inflammation makes it more likely to have a heart attack or a stroke. And this study is pretty consequential because it could also help explain why certain people who get COVID then have a greater chance of getting cardiovascular disease, or why those who already have cardiovascular disease suffer more heart complications after catching COVID. We have our experts on hand, as always, to answer your questions, so be sure to send them in to us. You can chat with us live on YouTube, Facebook, the X platform, or the All Things Heart email. We are everywhere for you. You'll find all those links on how to connect with us right there on your screen. The COVID pandemic impacted all of us in one way or another. That's a fact. But it took an enormous toll on Michelle DiMartino. Michelle lost both her parents in less than a week. And as Janine Kiesling shows us, Michelle would then face a health crisis of her own.
Michelle DiMartino ran 10Ks and was always active. She contributed her increasing heart rate and lack of energy to stress. But as it turns out, she had a potentially deadly heart problem.
It's not even like work. It's honestly just fun.
All right, let's get to our community questions.
You might recognize Michelle DiMartino from our morning medical update.
We're going to talk about a new therapy that could not come at a better time than right now.
Not as a guest, rather an integral part of our team.
Hayes is holding steady as well.
For 15 years, she's been a professional sign language interpreter.
This is where the magic happens.
She was introduced to signing very young because of a personal connection. Her cousin happens to be deaf, and in elementary school, Michelle was placed in a special education room after being diagnosed with dyslexia. It was there she met some of her lifelong friends who, like her cousin, are also deaf.
I just kind of picked it up and kept going.
It blossomed into a career. In addition to working for the University of Kansas Health System, Michelle interprets for the mayor's office and translated the NFL draft.
It's something that I've always loved and gravitated to.
While her career continues to flourish, Michelle, like so many others, was hit hard by COVID in a multitude of ways.
I was mad at COVID. I feel like it ruined my life in a sense. This is my mom and dad on their wedding day.
On February 4th, 2021, Michelle's mom died from COVID. 5 days later, it took her dad.
This year's been really hard. It's my dad's birthday today, and he was my best friend in the entire world.
Reeling from the heartbreak of losing her parents, Michelle became depressed. Over the next year, she gained weight, felt increasingly anxious, and at times noticed her heart racing. Michelle believed her parents' death was the cause until she was diagnosed with COVID for the second time.
I started to really notice that my heart was racing even more, and I was getting nauseous and lightheaded. I was sitting right here and kind of fell on the floor and was just trying to breathe.
Michelle was referred to the University of Kansas Health System. There, heart doctors were able to quickly diagnose Michelle and provided treatment she credits for giving back her life.
And that's what I love so much about KU is you're not just a number, you're not just a everyday patient. They really do take care of you, and it's as a collective team. Without them, I don't know how I would have gotten to this point today. Honestly, I'm most grateful for KU.
We are so grateful to have Michelle with us this morning in our studio. Michelle, thank you for being here.
Thanks for having me.
We are also joined by your doctor, electrophysiologist and cardiologist, Dr. Rigoberto Ramirez. It's so great to have you both here side by side. Michelle, you look fantastic. This is you, 96 pounds after you were diagnosed with COVID. You've been on a health journey since then.
I have. It's been quite a journey, and I was watching the package and got like emotional because I'm finally at like a happy place in my life thanks to KU. Because really they're like my family, and if it wasn't for this place, I don't think I'd be in such a good place right now.
That's so wonderful to hear. And I want to say we're so sorry about your parents. And can you just tell us, before we get into the medical journey, about your parents and what they were like? And
oh my gosh, so my parents were two of a kind. My dad is and was and always will be my hero. He fought for a good part of his life. He fought cancer, Alzheimer's, and then eventually COVID. And my mom was the sweetest soul in the world. She would feed everybody who would come over to the house. We had a big Italian family, and they were just two of the sweetest, most beautiful couple ever. And they've taught me how to be the woman I am today.
It's okay to talk about them in the present tense too. You know?
I know.
When you say he was your hero, he is your hero.
Yeah, he is.
Will be forever.
Oh yeah, he definitely is. And my mom is my rock, and she's taught me how to be the mother that I am today to my boys, who are my absolute world, and the reason I'm still working hard today.
That's the legacy that they leave behind in you.
Oh, yes.
You lost both of them about 1 year after the pandemic began. They passed the month the shot had become available, the vaccine had become available. Your mom, had she been able to make an appointment?
We actually had her planning to go 2 weeks before she got sick, and we had discussed it. She was ready to get the vaccine, and we had decided as a family that my dad, since he was in the nursing homes, he got the first vaccine, but didn't get the second vaccine until after he was diagnosed with COVID. And he never got COVID pneumonia. My mom is the one who did, and she was literally 2 weeks shy of her age group getting the shot.
And we often hear of couples that pass very close together when there is bonded. They're almost like one person.
My dad could not go anywhere without my mom. Like, he was the one, he would always be like, oh, go out, do what you need to do. But then he would be like, when are you coming home? When am I going to see you? And so it's kind of bittersweet thinking of it. When I went and told him that my mom had passed, I think it was, my dad held on for so long. He fought for so long against his cancer, and I think he finally was like, you know what, we can go to eternity together now. And so they're there
together, watching over you,
watching over me. Yep.
Now, when did you get COVID?
So the first time I got COVID was, I woke up Christmas Eve and had no smell and no taste. I was freaking out because back then that was like the #1 thing. Everybody lost their smell or their taste, and immediately I knew.
And you had received the vaccination?
I had not gotten the vaccine.
Oh, you hadn't gotten to get it yet?
Because they had only done the nursing homes. So
so you were still waiting.
Yeah, the hospitals and my mom's age group were going to be at the same time. So I was 2 weeks shy also.
And when did you notice something was changing with your heart? I know you mistook it for anxiety and grief, which you were feeling, no doubt. But when did the heart fluttering start?
The heart fluttering, I noticed, it was a couple of months after I got the first round of COVID. But like what you had said, I had attributed it to depression or just anxiety in general. And then I got COVID again on the 4th of July. And it was about a month after that, my Apple Watch started giving me notifications that your heart rate's too high, it's too high. And I'm like, oh, maybe it's still anxiety. But then I started getting lightheaded and nauseous, and I was like, maybe this isn't anxiety. Maybe I need to mention it to my primary care doctor.
As you said, you collapsed at one point.
I did. And my dogs, their intuition, they knew something was not right. They were right over me, and my watch was like going off. And it was like, you have an excessive high heart rate, and it just kept going off. And I was like, this isn't normal. I know this isn't just anxiety.
And Dr. Ramirez, I know you're nodding your head yes. This must be a common theme and a thread in the patients that you have seen. Is it common that people would get this heart pounding and this fluttering post-COVID and then come to you with this?
It is very common. So this is one of the number one thing we've seen patients and an increase in office visits for is palpitations and tachycardia, so heart racing sensation after COVID. And it can be as soon as it can be actively during COVID or shortly after. It can be months after the COVID infection. And so we've had to learn, as we've learned more, we've had to learn with the whole COVID and the progression of the disease. And fortunately, a lot of this we've been able to just rule out the most dangerous things and just focus on a lot of reassurance. And with time, things do get better, but there's other times where that's a lot. It's easier said than done.
Michelle was diagnosed with something called long QT. What's long QT, if you had to explain it in simple terms?
Yeah, so long QT is a complex condition, and we're going to show you an EKG here. It helps you understand this, but long QT is a condition that's first diagnosed with an EKG. So it's an initial screening tool that we use. So when Michelle came in to see her primary care provider, one of the first things they did, since she was having palpitations, the heart racing sensation, is get an EKG. The EKG, when you look up here, has several spikes and several bumps, and as you can see, the big spike here in the middle is actually what they call, it's when the heart is squeezing or contracting. And at the beginning part of that spike, there is a Q wave, and that's labeled here on the graph. When you look right after...
The super pointy one is the Q?
The big tall pointy one. If you look right after that big tall pointy one, you see there's a bump, and that's called the T wave. So from the beginning of the time that your heart starts to squeeze and that electrical current goes down the heart to the end of that second bump that follows that, that's called the QT segment, okay? So that, all of these segments have to have a specific length. There's an interval that has to be consistent, and normal intervals for a QT segment in men are less than 440 milliseconds, and women it's less than 440 milliseconds, okay? And so in Michelle's case, when she came in and saw her primary care doctor immediately noticed that the QTC was long, okay? And so that prompted the referral to see the specialist, to see me. And my responsibility when I see this is to, identify the risks associated with this, okay? First of all, sometimes the EKG assessment or the computation on the EKG is not accurate, and that could be one cause of it. The second part of it is, if it is accurate, we have to figure out what could be the causes of the long QT. There's two forms of long QT. One of them is an acquired form, and then there's the hereditary form, okay? The hereditary form of long QT syndrome is the prevalence is about 1 in 2,500, and that is the one that we're trying to rule out, and it comes with more consequences, which I'll touch on here in a little bit. The acquired form of long QT is more of a situational type of syndrome. So there are certain things that can cause that long QT to prolong. So you may have a normal QT segment, but when these circumstances arrive, they may actually push that long QT out. And if it does become longer, that can cause you to have problems. The biggest issue associated, the biggest concern that we have is if that QT segment gets too long, you could have ventricular arrhythmias that can be dangerous.
So, a couple questions here. Was the situational cause for Michelle, was that the COVID that triggered it?
So it's one of the circumstances. So in Michelle's situation, she had first she did have COVID. She was past COVID, but she was dealing with a lot of the kind of the consequences of COVID, and frankly, she had a lot going on, and those contributed to the tachycardia and probably the racing heart. Increased adrenaline was causing her to have some of these, but that got her in to see the PCP, which then her primary care provider, that then led to an evaluation by me. But when I looked at Michelle's EKG, her EKG did look long. It's correct. Her EKG, that QT interval was about 480 milliseconds.
How bad is that from what you've seen before?
Yeah, when we look at these EKGs, I get very concerned when that QT interval is 500 or more.
And hers was that?
And hers was 480.
So pushing that danger.
It is higher. So what I look at that point is, Michelle and I sat, we looked through her medications. We talked about her, her episode. We also, we talked about family history. We looked at, whether she's had any unexplained deaths. We talked about that were sudden. And then we looked at her medications. And there was a couple of medications that she was taking that certainly are classically known as prolonging the QT interval. One of them was the trazodone that she was taking, and there was another one, the Zofran, which is an antiemetic or an anti-nausea medication that she was also taking. So,
Benadryl.
The Benadryl was
Benadryl can do it?
The third. Benadryl, less of an effect, but the other two certainly can. But
So is it possible for long QT to be triggered by grief or something traumatic, or is it there are people who will experience horrible grief. Are they all at risk of long QT, or is it the grief combined with the COVID, or is it just the COVID?
Yeah, no, I think that I think it's two separate entities.
Okay.
So the COVID and what she had. So in the acute setting of COVID, you are at higher risk of having a prolonged QT. Just the infection itself. If you have fevers, if your heart rate is faster, there's more adrenaline in your system, that QT interval can get longer.
Okay.
And then the thing that I classically present is when patients come into the hospital, they're not feeling well. What happens is we're trying to figure out what's going on with them, but they have a little bit of nausea. So you start him on a medication for anti-nausea. Then you think they have an infection. You start him on an antibiotic, and then that night they're having a hard time sleeping. Then you give them a sleeping pill, like trazodone, and that combination there, along with the illness and even some electrolyte abnormalities, is what pushes that QT interval to be long. So COVID can trigger this if you have the predisposition to it, but remember it's rare, 1 in 2,500. But it could give you the acquired form, which again, it is still rare to have these ventricular arrhythmias associated with this, but when you come in, incidentally, that's the first time that you're going to be told that QT interval may be long.
When you look at the number of cases you had of long QT before the pandemic and after the pandemic, how does that stack up?
Yeah, it's about the same.
It's about the same.
It is about the same.
Okay.
I think that what we do see is that COVID has really brought attention to several different conditions. It has brought a lot of young patients, healthy patients, in to see a primary care doctor, have brought him in to see specialists because at this point we're identifying incidental findings on EKG. And a lot of times we see a lot of patients, and fortunately most of the time we're able to reassure them after appropriate testing. So we can get an echo, we can get a monitor, we can put a monitor on them, an ultrasound of the heart with the echo and monitor. monitor, and we can do even a stress test if we need to. But if those come back negative, we can provide some reassurance with close monitoring. And like I always do, when Michelle came in to see me, I see them for the first time. We have a long discussion. We talk about as much as we can. Probably spend a lot of time with patients, but that's the way that we try to do it. And then after that, there's a close follow-up to just make sure that we got things right and that we didn't miss anything. And we always try to do that for our patients, especially our new patients.
Michelle, you always start smiling when Dr. Ramirez starts talking. I could tell there's a genuine affection between you two. What was it like that first visit, and then what was the plan moving forward after you left Dr. Ramirez's office?
Well, the first visit was great, and like what he said, he sat down and really explained it more in layman's terms. I mean, I do a lot of medical interpreting, but this is something that I hadn't heard of until all this started happening. But he sat down, he drew me a diagram, and we found out that I had also a little bit an extra pacemaker in my heart that was kind of firing, and I didn't actually even know that your heart had pacemakers, and that's why you get a pacemaker. And so he was explaining about how the extra pacemaker was kind of firing, and then my other pacemakers were kind of getting all messed up, and that was making my heart go even faster. And for him to explain that and me to see it on paper, and then also know, I was making probably some not of the best health choices, with just taking care of my body. And he explained to me, if you don't want to go on a beta blocker, if you're already tired, we need to make these life changes. And it was a real big eye-opener. But the fact that he just I wasn't just a number, I guess, to him. I really felt like he cared about me. It was genuine, and he took the time to explain everything that was going on and what routes we could take. And after discussing all of that, it really, that was the beginning of changing my life for the better. And I think it was also the beginning of me going through a journey of finding myself in my life again. That's led me to here today, which I am in a very, very good, happy place now.
That's so wonderful to hear, because you've been through the ringer. Yeah. You've been through it. You've walked through the fire.
Yes.
And coming out of it, when you talk about lifestyle changes, Michelle walked in and Michelle said, "This is me 96 pounds later." And I that's stunning to me. How did you lose the weight? Was that part of the lifestyle change, I imagine?
It was a big part of it, because I was kind of eating my feelings, I guess you could say. But I ended up deciding I needed to really make a lifestyle change, and that led me to the weight management clinic here, and I started to go back to my walking and running. But when you get older, your metabolism, your body changes, and I did need help with once I hit a plateau. So I was put on Mounjaro, but I decided that I didn't want to be on that for the rest of my life.
And for people who aren't familiar with Mounjaro, what's Mounjaro?
Mounjaro is a injection that a lot of diabetics use, or people who have other pre-existing conditions, such as myself with my heart, and it does help you lose weight. And it kind of gave me just that kickstart that I needed to get past my plateau, and it really did help. I'm not even on the full dose. I never made it to the full dose, and now I only do one shot a month, and eventually I'm planning to get off of it. But I started that journey knowing I didn't want to rely on the shot, so I made the healthy lifestyle changes of what I eat, what I take into my body, and exercise was a really big thing that he had mentioned. I was tired, but I had to do it. And I mean, I was just telling you guys, we just climbed Camelback Mountain, and I could barely get up my stairs a year ago. So
a year ago, moving was hard. And now you're climbing
anything was hard.
Yeah.
And then I climbed a mountain, and it was the most amazing thing.
That is great. Yeah. We're getting a lot of questions from the community, so I want to go to our community questions and our viewer questions. And Jean Reardon has a good one coming in. Jean wants to know, Dr. Ramirez, what are the symptoms of long QT that people need to look out for?
Very good question. So long QT is usually incidentally found, okay? So what happens, the episodes that I discuss that I talk about with long QT tend to be palpitations, unexplained fainting spells, or dizziness and lightheadedness, okay? Especially in the setting of having relatives that have had, a diagnosis of long QT, you have to have high index of suspicion that, you could have the same condition, or, other unexplained, deaths within the family, okay? But a lot of times you come in to see the doctor with these symptoms, and the EKG really is the first time that you're gonna hear that your QTC is long. And at that point in time, you get the referral to me, and we start talking and stratifying how risky that QTC is. Is it real? Is it acquired? Is it possible hereditary? Do we need to do more testing? And at that point, we proceed with the workup.
Yen Liang would like to know, this is a great question, could broken heart syndrome lead to long-term heart problems? And we've heard broken heart syndrome as being triggered by having a broken heart, like Michelle has had, or so many people watching have had broken hearts.
That is an excellent question. So, it's broken heart syndrome is real.
Could it cause heart problems, long-term heart problems?
With broken heart syndrome, the diagnosis for this, they also call it Takotsubo, cardiomyopathy. Okay, so there are patients with a significant stressor, whether they're ill, an acute COVID infection or some acute viral illness, or they have a significant life change. Just like what Michelle went through, where the heart can get stressed. That diagnosis of broken heart syndrome is actually, you get an ultrasound of the heart and you will see that the heart's weaker and the heart is dilated. And so it's very rare, but when it does happen, you get those patients are important to identify because they are at risk of having other arrhythmias. Fortunately, with broken heart syndrome, you start them on good medications to help suppress and give the heart some time to heal. And you rule out other things that can cause a weak heart and an enlarged heart. And over time, once that stressor passes, you will be amazed. Patients will they'll improve. The heart will get back to normal, and at that point, you continue to live your life. Maybe you'll be on a medication just for, to make sure that, to give your heart the best chance to heal. But I'd say most patients recover, okay?
I saw something in Michelle's eyes when Dr. Ramirez was talking about broken heart syndrome. Did that make you think of your dad?
Yeah, and it made me think of me also, because I didn't know that could happen. It made me kind of like sympathize and have empathy and sympathy for people who go through that, because it is your heart hurts. And I know that I was feeling that, but I start to think of like my dad as soon as like he said that, like what you said, I was like, did that happen? Right. And that just allowed him to go be with my mom. Right. So it was one of those things that just kind of like went in my head, and I was like, huh, interesting.
They were so bonded. Yeah. Jeremy Yenster has a question. He wants to know if the treatment or future outlook is different at all if you have the acquired long QT that was brought on by an event, or if you have it genetically, you started life with long QT. Is the treatment different?
Yes, the treatment is different. So acquired long QT can be managed with an adjustment in medications, kind of avoiding certain triggers, making sure that, electrolytes are appropriate. But mostly that can be managed with an adjustment in a lifestyle, okay? Now the hereditary long QT syndrome is important because that is a lifelong monitoring and management of this rhythm. There are medications that you start patients who have long QT syndrome that they have to maintain for the rest of their life because it does reduce the risk of having these dangerous rhythms. Some patients, if they're having episodes of passing out, blacking out, these really bad tachycardia episodes, or we see that some of the workup shows that they're having these dangerous rhythms, even if they're not long, those patients may require things like a defibrillator. those types of things. So once you have long QT and we suspect it's hereditary, typically you will undergo genetic testing, and there are 3 different types of genetic mutations that we look for that can be diagnosed with that genetic testing. Once that genetic test, if it does come back positive at that point in time, you'll follow with me lifelong, and you may start this medication, but that medication, which is called the beta blocker, has been instrumental in preventing, sudden cardiac death and the need for an ICD, and so it can make a huge impact on your life.
We have time for one more question. Ruth Ellen, another Facebook viewer, wants to know if you wear a heart monitor for a month, will it indicate if you have long QT, if you've been wearing a heart monitor for a month?
The heart monitor does have its own measurements, and you're able to tell at different heart rates whether that QT interval is responding to those different heart rates appropriately. Okay, so what happens with long QT syndrome is that segment is supposed to get smaller as your heart rate is increasing, but what happens in patients with long QT is it stays the same. So if your heart rate is at 50 beats per minute, we have a long QT. If it's at 100, that QT interval should be less. And what happens with exercise is it doesn't get smaller, and that extra beat, that next beat that comes at the time where the heart's trying to recharge and it's not ready to accept that beat, and that's what can promote these dangerous rhythms. But what I'm looking for on that monitor as well is I'm looking for those dangerous rhythms from the bottom chamber of the heart, and some signs on that monitor that is a potential trigger that's putting you in this. If I don't see any of that, if the QT remains the same, there's none of those dangerous rhythms, I can say, okay, I'm confident that that's probably it's a lower risk type of event, especially if the QTC is on the lower side.
I got to say, the way you explain things, Dr. Ramirez, it makes it so comforting and understandable when you describe it as an electrical, almost like an electrical panel. It's you have the ability to explain things in human speak rather than brilliant doctor speak, okay, which you are, but it's comforting, and I know that's one of the things Michelle really says she loved about meeting with you, which is I want to bring Michelle back in, and I want you both up here for some final thoughts. Michelle, what would be your message to viewers watching who are really in the weeds right now, as you were not too long ago?
I would definitely say learn your body and trust your doctors. If something doesn't feel right, speak up. That was the best thing I could have possibly done. And I am just a huge, huge fan of KU. If you are watching and you're not a patient here, maybe you should be. I'm just saying I love this place. They have become my family. I don't know what I would do without KU. I don't know. But you guys are amazing. The doctors here are amazing. Everybody in this studio is amazing. I really love this place. And yeah, know your body, talk to your doctors, trust them, and trust everybody here because they're amazing.
That wasn't in the script. No. I promise you, we didn't tell Michelle to say that. It's so nice. And it must be so wonderful to hear that, Dr. Ramirez.
Well, Michelle, you're the reason we do this, right? And I think you've done a lot. You've gone through some very difficult situations. There are many patients I see where I give them reassurance. I recommend that they do, certain lifestyle changes, and I have to really work on those things with them, and it's over several visits, but you really took this, you ran with it, you've made some significant changes, and this is why we do these things, because it makes a big impact in your life, and it is really important to see these changes as a physician as well, because it keeps us going.
It's beautiful. We love being able to highlight the incredible work that our doctors do at the health system, like Dr. Ramirez with Michelle. We also love showing you what life looks like for them outside of these hospital walls.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
Okay, Dr. Ramirez, we are going behind the mask with you this morning. You shared some fantastic family pictures. Who are we looking at? This is a beautiful cast.
Yeah, so I have 4 kids, so you're looking at, my oldest is Gabby, she's 10. I have Eddie, which you see there, he is 7, just turned 7. Pila, right there, is 3, and then the newest addition is going to be 1 on the 4th of November. So that's my wife there. That's Anna, and it's on a recent trip we took. And
now that's a good picture right there.
Yeah, this is just us. This is my brothers actually. I have my 3 brothers. I have a sister too, and that's a good friend of ours at a Chiefs game, of course, and enjoying the game. So.
And are your kids, I got to ask, are your kids Taylor Swift fans? Are they talking about that at home?
So my daughter just had a birthday party, and it was all Taylor Swift themed. So she had a dance party up at the in her room area, loft area, and then she came down and basically did some crumble cookies, and then she went down and watched the Taylor Swift concert.
Is that bleeding over into her liking football now?
She has been really, she does flag football, and
nice.
Their team it's been really good. They have a good group of girls, and she enjoys it so much, and so she's loving football. Big, Taylor Swift and Kansas City Chiefs fan. So.
And her boyfriend. Taylor Swift and her boefriend.
Yeah, the boyfriend is just, comes with the territory.
He's all right too, right?
He's okay. He's good. He's good.
It's pretty fantastic. Well, thank you, Dr. Ramirez, for making time. I know you're incredibly busy. Michelle, thank you for sharing your journey with us. It's going to help a lot of people, and it's wonderful to see you glowing now. It's beautiful. Your parents are definitely watching over you and guiding you.
Thank you.
I know you know that.